Hello and welcome. I'm John McAlevey, founder and host of the Quadcast podcast and a 33-year spinal cord injury survivor. I am proud to be working in conjunction with the North American Spinal Cord Injury Consortium on a series of informational podcasts. NASCIC has the mission to bring about unified achievements in research, care, cure, and policy by supporting collaborative efforts across the spinal cord injury community. With over 700 members supporting that mission, 70% are individuals living with SCI, along with their families and caregivers. The aim of this podcast series is to introduce people, organizations, and devices that are working on bettering the lives of individuals living with SCI. This episode is sponsored by Restorative Therapies, a global leader in integrated functional electrical stimulation, or FES technology. Their RT300 and Excite2 therapy systems are used in over 1,000 clinics and 5,000 homes worldwide, supporting more than 100,000 patients recovering from stroke, spinal cord injury, multiple sclerosis, brain injury, and other neurological conditions. These systems help address spasticity, muscle atrophy, and functional loss while promoting active rehabilitation. If you or someone you care about is looking for a customized neurorehabilitation solution, visit restorative-therapies.com to learn more. Joining us today are Laurie Magerfleisch and Colleen Connaughton from Restorative Therapies and Dr. Ian James Brown, a veteran and RT300 champion. And now it is my pleasure to welcome in Colleen, Laurie, and Dr. Ian. And right off the bat, I think we should have them tell us a little bit about themselves. So why don't you start, Colleen? Tell us a little bit who you are and how you got involved with restorative therapies.
All right. Hi, John. Good afternoon, everyone. I'm a physical therapist. I've been practicing for over 20 years. I wanted to go into PT to work with pediatrics. My first job was I did a little bit of pediatrics and orthopedics, and then decided I wanted to do some traveling physical therapy, which brought me down to Baltimore, where I worked at the Kennedy Krieger Institute, and I just fell in love with working with neuropopulation, in particular, the spinal cord injury patients. So I kind of went into that route and haven't looked back. In the last 18 years, really been focusing solely on neuro rehab and using RTI products when I first started at Kennedy Krieger. So I've been using them since 2006 and really have just seen the benefits firsthand for use in clinic and as well for the home customer.
Terrific. Laurie, how about yourself? Tell us about yourself.
Sure. Thank you for having us. I'm also a physical therapist. I worked at Bryn Mawr Rehab after graduating from PT school. They had some RT300s they got shortly after I started there. I learned how to use them, really, loved the device, took a course that they offered in the home office in Baltimore and really kind of fell in love with the company as well as the product. And about a year later, there was an opening on the clinical team. I was very fortunate to be able to work with an amazing group of clinicians at that time to help get even more immersed in this world.
Excellent. How about Dr. Ian? Why don't you bring it home for us and tell us about yourself?
So I'm a medical doctor, neurointerventional radiologist by trade. Prior to that, I was Air Force pilot and combat rescue officer, injured in the line of duty. From there, just wanted to move forward and get the most I could out of life. And in order to do that, I looked into all the different treatment modalities and ways that I could keep myself in the best shape I could. And speaking with congressionally directed medical research programs, I had a doctor that was working at Kennedy Krieger alongside of me, told me about RTI, and that's what first brought me into the device, dating back to, I'd say, 2007, 2008, somewhere in there, give or take.
Well, first of all, thank you for your service, Dr. Ian, and we look forward to hearing more about your journey and more information for us, for the community. How about Laurie? Why don't we start with you, this first
Yeah.
question? What led you into neurorehabilitation?
Yeah. So When I went into PT school, I was very certain I was going to do outpatient sports and orthopedics when I was done. And that was my whole focus through school until I got to my very last clinical rotation. I was on the SCI floor at McGee Rehab, had an amazing clinical instructor at the time, and really just knew that that was what I was meant to do. When I got done with my time there, I just realized how fulfilling it seemed to me. Not that orthopedics is not, but just the difference that I could really make in someone's life seemed really, really meaningful. So um, I chose to continue on in that path after that.
How about you, Colleen? Tell us about your story.
Oh, when I first, did that travel assignment working with spinal cord injured patients, I realized that the complexities and challenges that they faced were ones that I wanted to help them be able to tackle and find ways to be healthier and live the best, functional life that they could be able to. And just over time, working with a variety of different neuro diagnoses as well, it just seemed like that was the right fit. And like Lori said, the impact and the stories that these patients have, it's really nice to be a part of making the their lives healthier and better outcomes for
The
them.
SCI community, yeah, we certainly have stories to tell, it's amazing. I know with a lot of my brethren, um, we talk about how a lot of us have the same injury in the same area and the same level, and no two are the same. It's amazing how diverse
Mhm.
these injuries are, and what we're left with following our accidents and injuries. And speaking of injuries, Dr. Ian, if you could, I know you have a very interesting story about how you were injured. Can you take us on your journey?
Yeah, certainly. I'll try to give the short version so nobody falls asleep during this part of it. But going back to the early onset of the Gulf War, Operation Iraqi Endurance, and Operation Enduring Freedom, I had been on multiple deployments. I was getting ready for redeployment, uh, and on base, getting ready to go into the aircraft. I was driving, and the last thing I remember was leaving my house. Woke up 2 months later. I was paralyzed from the essentially neurologic C8 T1 level down, a little asymmetric. My spinal injury has changed on and off, sometimes better, sometimes worse, depending upon how much rehabilitation and exercise I do.
Mm.
Um, so it's been an interesting journey, I guess, learning all about how to live in with a spinal cord injury, and then me being a constant problem solver, tried to figure out how to make the uh, best for myself and my other brothers in arms that were injured, and find out what we can do for moving our outcomes forward. So from there, I dove headfirst into neurospinal research, working with Kessler Institute and a bit with Kennedy Krieger, working with congressionally directed medical research programs, uh, partnering with several of the titans of the industry, RTI, to help all of us get little bit better life and move the benchmark a little bit further forward.
And what would you say led you to the RT300?
Well, for me, when I was first injured, the only options were just typical FES, um, and long leg standing braces, and the archaic methods that have been around since the 1980s. The technology options were there, but nothing really caught on in the rehabilitation injury when I was rehabilitation workspace when I was first injured. So they were still using, 10, 20-year-old therapy methods for us back when I was going through my initial rehabilitation. I was introduced to the RT300 after I had completed my inpatient rehab and was working in medical research at the time, and found that this is something that all of the major research centers and rehabilitation centers need to get behind in order to bring more modern technologies to their patients. So when I looked at what the capabilities of the device were and saw how that aligned with my personal goals in athleticism and getting back into competitive shape, and also the medical benefits that are associated with the device in and of itself, I thought that this was a no-brainer to champion as a volunteer for our industry to try to get the rest of the rehabilitation centers and our neurologically compromised patients to be aware of so that we can bring this as a new modality, giving better outcomes to our community.
When you first experienced muscle activation again through FES with the RT300, what did that moment mean to you?
Well, as a lifelong athlete, it was great that I wasn't skipping leg day. So it was nice that I wasn't just sitting around waiting for the muscles to decay. It was great that I got a chance to get back into activity. And as a physician, that makes a huge difference for us outside of the quality of life and the mental benefit of it. We were a species meant to be active and up and moving. And when we are sedentary, it is disadvantageous to our entire body's metabolism. It's not just the fact that, your muscle density in your legs, it translates to the bones, it has all your metabolic markers that are associated with it. So for me, this was a phenomenal opportunity to work on my overall health, not just a device that I can move my legs. It's a much more beneficial aspect to the longevity and health and quality of life than simply just having more muscle density in your legs. I mean, it's great to, have better looking legs in a swimsuit, but at the end of the day, if that's, going to give you the same number and quality of years remaining, that it's not moving the benchmark much. But the device itself
Yeah.
has made significant gains for me. It helps all my biomarkers, blood sugar, metabolism, these kinds of things, which translate to a much better body to compete with. So in the 3 national competitions I had, 1 pre-medical school and 2 post-medical school, this was a competitive advantage for me, but I wasn't looking for the medals. I was looking for pushing my body in the benchmark. So for the other 900 some athletes, I would love for them all to be on this device so that we can all move into a healthier future. And if it starts from an athletics component, if it starts from a patient component in an inpatient setting, if it's an outpatient, to get them into a healthier uh, future, I think that this device works in all those capacities to bring all of us into a better quality of life.
Sure. What would you say your biggest physical challenges were post-injury?
Physical challenges, for me, trunk balance had always been a difficult one. Spasticity is probably the one that makes the most impact on my life because of my choice not to go on any antispasmodic medications, which leave you with side effects that I didn't want. I didn't want the drowsiness, the sleepiness, the lack of muscle activation when I want to use muscles. So I never really went on any of the muscle relaxants. And with a classical upper motor neuron injury, I have very, very high spasticity below the level of injury, not just in the leg muscles, but also in the trunk muscles. So it just gets to be a bit of a risk when I go to transfer. Sometimes I can rely on the spasms to help. Sometimes it's a little bit of a hindrance. So you learn to live with that. The other aspects of life that are difficult, obviously having neurologic compromise anywhere below the level of injury comes with its own difficulties. And I think that in and of themselves, they're all their own separate challenges for their own reasons. And everyone living with any kind of neurological compromise can identify with how it affects them personally. But for me, it was primarily transfers and safety issues were my big ones. The pain was okay because for me, the spasticity was a free workout. So it's
Right.
aligning with my athletic goals at the time. And now it just became second nature dealing with muscle spasms for so many years. It's just kind of part of who I have become.
Yeah, I hear you with the muscle spasms. I have them myself. I'm a 33-year spinal cord injury survivor myself at a C3-4 level. So I know exactly what you're talking about. What would you say changed once you began consistently using the RT300,
I
excuse me?
Subjectively, I had significantly more energy throughout the day. I found that my recovery capacity post exercise, whether it be on the on my quote unquote leg days, which are pretty much every day,
Hmm.
um, my muscle recovery and my workouts outside of the RT300, I had much less soreness in muscles, much faster minor injury recoveries from all of the transfers we do that put stress on joints. I think that my sleep increased quite a bit because some of the spasticity was going down.
Hmm.
And whenever you can impact sleep, whenever you can impact your recovery capacity, your life gets more function, which gives you a better quality of life. I think from a quantitative rather, perspective of it, I noticed all my biomarkers in my blood labs were normalizing into the better portion of the range rather than toward the upper limits of the range. So my hemoglobin, my blood glucose, all these things were trending in a direction that I would love for all of my patients to be able to have. Um, Luckily, I don't have any organ issues, but when blood markers get out of range, that's what we worry about. So for me, this is more about longevity, maintaining health, and keeping my metabolism as high as it can as I age. So trying
Yeah.
to age gracefully, trying to remain as functional as possible moving forward has been my goal, and this has certainly done that. I've also noticed that the have the benefit of working at a research center where I have constant DEXA scans, 20 odd years of them, and I've noticed that when I am
Nice.
on the RT300, the muscle density and my bone density in my legs increases significantly because I'm putting more stress and more uh, strain on the muscles, and they're repairing as we would expect. So it's great to have that for all of them, all of the aspects that add toward longevity of life. I think that it also adds into it helps me to prevent uh, onset of metabolic disorders and stuff like that, where you would become more insulin resistant as you're less active. So being able to remain active, having more muscle density in your legs, you have more of a glucose sponge, as I call it, to pull some of that sugar out of the bloodstream, which you know helps keep your organs from getting saturated from all the extra sugar, keeps your nerves from getting glycosylated. It keeps all the arteries open and better blood flow, keeps your lymphatic systems open. So it helps your immune system, your metabolism. For me, sleep. For me, my injury recovery. And I think that the device in and of itself, beyond just what we can statistically prove, subjectively has had such a greater impact that I would be really happy if more patients got on this to see how it impacts them and how we can all like collectively live a more qualitative uh, life secondary to using functional electronic stim with a device like the RT300.
Yes, and consistency with it, the sessions is a big part of it. How did home access influence your consistency?
For me, that cut travel time down to using the device and being so far from a center that had one. I was fortunate enough that as a disabled veteran, we do have some of these in some of the different VA systems out there. We would
Hmm.
like to see them in more of the systems so that more patients had access to them. And again, in the corporate world, we would love to see some of the private health centers out there also adapting these. But sometimes getting out of the house all the way to a facility, staying in a facility to train, and then getting all the way back home is a significant portion of your day. The travel portions of it, sometimes people like have a neurologic compromise that makes it more difficult for them to get ready and get out of the house. So rather than cut the full time chore of using the device down to almost nothing, I could have the leads that I need and the wires right next to the bed. And when I get up in the morning, I could put my electrodes on before getting into my wheelchair, start my workout. While I'm going through my workout, I could be working on my emails if I have work related stuff, or if I'm just trying to catch up on a weekend and try to keep pace with my better half's Netflix binging. If I'm trying to catch up on sessions I haven't seen, I can, do that for about an hour or so while I'm riding the bike. So it's been a minimal impact on my time and a maximum impact on my health. So it's been boon to have it in house. I think that my compliance on the device is significantly higher than what it would have been if I had to travel to a center to do the same.
Yeah. Ease of execution. That's a home run all around. And so Why don't we tackle some FES questions now? And I'll bring Lori and
Okay.
Colleen back into the conversation. Lori, how do you explain spasticity to patients?
Yeah, that's a really good question because so many of our patients with spinal cord injury are affected by spasticity, as Dr. Brown, just talked about with himself. So spasticity after spinal cord injury is basically muscle overactivity happening because the brain and the body can't communicate anymore because there's a disruption. So when the spinal cord is injured, messages from the brain can't get through to the muscles below that injury level anymore. So braking signals, the kind of signals that tell the muscle when to turn off, are reduced or lost. So if something triggers a muscle to activate, it might do that abnormally. And that's when we get that tightening, the stiffness, shaking, or jerking that can happen. So just kind of in short, it happens because the muscles can still be activated by certain triggers. So someone stretches you, experience pain or something like that, but the brain can't properly control or calm those signals anymore.
Hmm. Are spasticity and tone sort of friends? Are they different? Are they the same thing? I know I've heard over the years say, "Oh, John, your tone is off the charts today." And so, how are they
They're
dissimilar, and how are they similar?
Well, that wasn't one of your questions. They
No,
are
it wasn't. I just figured I would throw that one in
they
there.
are similar. They are friends. So we all, we have some like resting muscle tone. So there's some level where, if we didn't have any tone at all, we'd be kind of like wet noodles, right?
Yeah.
So, those of us without injuries, all of our muscles have some resting tone.
Hmm.
After injury, some of those muscles may have more tone where they kind of stay activated and stiff, whereas the spasticity is triggered more from like a movement or something like
Right.
that. So they are related.
Hmm. Okay. We'll get back on script now. How does
That's okay.
patterned how does patterned FES influence tone, Lori?
Yeah, so FES can actually help provide those braking signals that we need to normalize the spinal circuits again. So without the braking signals, that spinal circuit would just keep firing and we get that abnormal muscle movement. But now the FES can help with that inhibitory input to kind of calm those signals down.
Hmm. And what would you say consistency changes over time?
Yeah. So, what research has shown us is that, after a single FES cycling session, most people, can experience some reduction in their spasticity, but it's usually pretty short lived. Whereas if we consistently do that FES cycling over time, so in terms of frequency of sessions, length of sessions, we can get longer term effects and decrease in that spasticity and tone.
Hmm. How about Colleen? What happens physiologically when muscles remain inactive?
Yeah, well, Dr. Ian started off that a little bit talking about muscle decay, which is what we also will call as disuse atrophy. So if you're not using your muscles, they're going to shrink. You'll have a decrease in the strength, the shape and size of your muscles, as well as your endurance. And
Hmm.
over time, that's going to lead to all of those issues, those other secondary health complications with less blood flow, less cardiovascular health, changes to your metabolism, is all those lab markers and blood values that Dr. Ian was talking about. So that all will occur when you're not using your muscles, for both someone who has a neurological injury or doesn't have one. And when there's
Hmm.
connect between the brain and the spinal cord and the nervous system, it just makes that more profound, that loss that you'll see when muscles are.
Sure, sure. And how would you say does FES help prevent disuse atrophy?
Yeah, it's a great question because the benefit of FES is that it's making those muscles contract, whether those muscles are unable to voluntarily or just aren't strong enough and don't have the same power as before. When you're using FES, so you're putting electrodes on the skin that's going to make the nerve tell the muscle to fire to cause that contraction. Then you're able to get all of those same benefits that you would for being able to use those muscles. Increasing the size of the muscle bulk, decreasing any of all of those issues with that glucose reuptake and those metabolic things that will occur, and being able to improve your cardiovascular fitness, especially if you're talking about FES cycling.
Sure. Lori,
Yeah.
how would you say does muscle contraction affect local blood flow?
Yeah, this is another great benefit of FES cycling. So when the muscles contract, the vessels are compressed, they push blood out of the muscles. When the muscle relaxes, the vessels reopen and we can bring fresh blood in. So, with repeated contractions, we get kind of a rhythmic pumping cycle. We call this a muscle pump, which can increase circulation through the muscle, reduce pulling of blood in the limbs, improve venous return towards the heart, and bring oxygen and nutrients to the muscles and remove metabolic waste.
And now, why does circulation matter in long-term SCI care?
Yeah, there's a number of reasons why this is really important. So, number one, if we can prevent pooling of the blood in the limbs, we can help prevent blood clots from forming, right? And blood clots can then lead to you know, other things if they get loose and travel through the body, whether it's, they get lodged in the brain and cause a stroke or into the lungs for a pulmonary embolism. So preventing that is really important. But improved circulation also helps reduce swelling in the limbs, right? We see that as a big problem as well. It can help maintain muscle health. I think Dr. Ian touched on that a little bit, metabolic health, improving temperature regulation, supporting healthy tissue and bones, and really important, also reducing the risk of pressure injuries. If we can keep blood flowing through all of those areas that, maybe are getting compressed in your chair just from sitting all the time, you can get that
Sure.
blood flow in, maintain the muscle mass and circulation. We may be able to prevent pressure injuries as well.
Hmm. Colleen, how does
Piggybacking on that,
repetitive
Oh,
contraction influence joint health?
Um, so we need to have our bodies to be moving. The joints need to have that the fluid moving to help nourish the joint surface itself. We need to be able to reduce stiffness and maintain flexibility, and you get that all those benefits when muscles are repeatedly contract. Allowing for that range of motion. As Dr. Ian said, we were made to move. Our bodies weren't made to be idle. So for patients living with spinal cord injury, those joints aren't often able to be moved on their own, then you end up with tightness and contractures, and that affects your ability to transfer and perform your normal daily activities. So by having the benefit of FES and making your muscles contract, you're keeping those joints moving, which is supporting comfort, mobility, and helping for overall long-term health.
Hmm. Now let's talk directly and specifically about the RT300. Colleen, if you could, what makes the RT300 different from traditional cycling equipment?
Yeah, it's a great question, John, and not everyone fully understands. It's not just an exercise bike, right? We're using advanced technology to make those muscles contract when they can't do it on their own or are too weak to do fully on their own. So some traditional cycling or bikes will either there's a motor that's going to just help to passively move the muscles, or someone may be using their arms to help move their legs. Where it's using the RT300, you're getting a repetitive patterned activity by using the FES to make your muscles contract. So it's allowing your muscles to be active and getting an active contraction and all of those benefits that the three of us have been outlining that their body needs when you get exercise. So it's
Sure.
important to know the muscles are being actively engaged and it's not just a passive activity.
Hmm. How does multi-channel integrated stimulation change outcomes, Lori?
yeah. So, by having multiple channels of FES, one, it's more efficient. We're getting, more muscles involved in this, which can help with, getting a better cardiovascular outcome here. But it also moves treatment from just an isolated muscle contraction or activation to coordinated, more task specific movement patterns. So these patterns more closely resemble how our bodies are supposed to work, right? We can stimulate multiple muscle groups in the correct timing and sequence to create that movement pattern and a whole movement experience for our nervous system, which promotes better neuroplastic changes and better motor learning. More channels of stimulation also increases the amount of sensory input into our nervous system, which is really important overall. Part of this is how we can reduce spasticity, get some more other motor learning out of this as well. Um, so really we're facilitating improved task specific practice, improved range of motion, and also coordination because we're telling those muscles when they're supposed to be on and off together, not just in isolation.
Absolutely. And how does automatic spasm management improve session continuity, Colleen?
Yeah, that's a great feature that is patented for the RT300. And the benefit of it is that it will allow the stimulation and the speed to slowly ramp up in the beginning of the session so that it works with what the patient, how they're presenting that day. I think Dr. Ian said, some days he had more spasms and tone when he woke up in the morning, and sometimes he didn't. So everybody is going to be different each day. So when that's an issue for a patient, the autospasm management, especially for those home users, can make a difference in just kind of reacting to what your body is at the moment versus something being set and standard across the board. It gives that, dynamic
Mhm.
individuality to the program.
Sure. And what changes, Lori, when patients transition from clinic to home?
Yeah, there's a lot of benefits to having access to the RT300 at home, even if they're not discharged from clinic yet, right? So if someone's not discharged from clinic, it gives them the ability to focus on other things while they're in clinic. But then having that access at home is really important. Dr. Ian touched on a lot of things already in terms of, you know, not having to leave the house, getting it to fit more efficiently kind of into your day. But it also allows people to cycle more consistently, right? So we all need physical activity. The Surgeon General, the American Heart Association recommend 3 to 5 times per week for moderate aerobic activity. Um, this is usually, 3 to 5 times a week for 60 minutes allows them to get that. And they can get that at home now with less time because they don't have to leave the house. And it's that consistency that allows them to get those health benefits like maintaining muscle mass and the cardiovascular benefits, reducing spasticity, things like that, but also maintaining the gains they made in therapy, right? How often do we hear a patient say that they go back to clinic once a year for kind of a quote tune up, but in that time, did they lose a lot of the things that they had gained during the previous year's tune up? So,
Hmm.
super important. And just to mention, Restorative Therapies has a really robust system in place to make that transition as easy as possible for patients. Someone goes to the house, trains them, sets up the bike, kind of optimizes everything, and then they can get support from there to make sure that they're getting optimal benefit from their system.
And I think it's
Am I allowed to
important
put
to
that plug in?
Yeah. I think it's really important to know that restorative therapies also offers a task-specific recovery solution that can be used in conjunction with the RT300. And today, while we're focused on the RT300 therapy system, we will also do a follow-up podcast that focuses on your Excite 2. And so we are excited about that to do that down the road. And so I figured now what we could do is open this up to sort of a round robin rapid discussion on thoughtful responses. And we could go around the horn here. We'll start with you, Colleen. How do you determine the frequency of sessions for patients?
The goal is to get someone to be up to 3 to 5 times per week for up to 60 minutes, as Lori mentioned. That's what the Surgeon General and American Heart Association say is what is needed to get 150 minutes of strenuous activity a day. So for a home customer, we tell them it can probably take you up to 2 months to be able to build up to that frequency and duration so that you're allowing both your muscles and your skin in order to to tolerate that amount of activity.
Hmm. Dr. Ian, how about you? We'll bring you back in here. How do you determine the frequency of your sessions? Is it some weeks you ramp up, and some days if you're not feeling as limber as could be, you shut it down a little bit? How do you figure out your week?
Well, let's just take last year, for example. I was preparing for the National Veteran Wheelchair Games, and as I ramped up my home activity, I started off roughly 3 times a week. I found that once my body was able to accommodate that no problem. I started changing the settings in the device to push me harder and harder. And the great part about that is the device adapts to me and I adapt to the device. So it enabled me
Uh-huh.
to continue my gains throughout the entire training session leading up to the games. I was training sometimes between 4 and 6 a week just prior to competition. What that enabled me to do was to get to my quote unquote zone 2 cardio. That's all the buzz nowadays because that gets it your metabolic heart rate about 70% of your maximum heart rate. You get the benefits of fat burning, which for me as a competitive power lifter and a CrossFit athlete helps me get the maximum body composition. Because if I have less body fat and more muscle, that distribution puts me in the best aerobic and muscle density per body pound in the two weight class based sports I was competing in. So
Mm-hmm.
for me, it helped get my body optimized for competition. Now that might be a bit extreme for people trying to do 6 times a week, but for my specific goals at that time, it was great. Once the game's finished, I went into the off season. Now I scheduled my uh, surgeries and rehabilitation, and then this polar vortex hits. So I've been off the
Right.
device for a couple of months. Um, Jumping back into it because I've got the 2026 games coming back up. So as soon as I get back from travel, I'm going to be ramping back up, starting my 3 times a week, and then very quickly within a couple, I would imagine a week or two, probably ramping back up. It's that 5 or 6 times. That consistency for me builds life habit, builds better sleep, increases my recovery, so it helps my workouts be more effective, and I get more recovery for each of my uh, gym workouts based on how I'm metabolically treating my body. And for me, the consistency helps all of my metabolic profiles. As mentioned before, my immune system kicks in high gear, so it keeps me healthy when I'm out in public places and such like that. We had discussed briefly some of the cardiovascular benefits of the device. One of the pithy quotes that I got my residency program from one of our leading cardiologists is that the calf muscle is the second most important muscle in your cardiovascular system. For those of us that are wheelchair bound, or anybody that's neurologically compromised that's sitting for a long time, you don't have that calf returning all of that used blood back to your heart to be cycled through your liver and kidneys. So we're
Sure.
not cleaning our blood as much as we would like to. So a device like the RT300 puts us a lot closer to being back on our normal path. So the more frequently I do that, the healthier I get, the healthier the other vessels in my lower body get, the cleaner my blood is, and the better my health outcomes are secondary to using the RT300.
Amazing. Amazing. And Lori, what does long-term consistency look like?
Well, ideally, it looks like Dr. Ian. Really, it is that 3 to 5 times a week for 30 to 60 minutes to get that recommended amount of physical activity. We know that not everyone can do that, but the closer you can get to that, I think the healthier you can stay. We've seen just from our own examples of patients at home that cycle, nearly every day or at least a few times a week do stay very healthy. They're not being rehospitalized, getting pressure wounds, respiratory infections, like a lot of our patients with spinal cord injury are prone to. So just getting that consistency in is really, really critical for maintaining overall long-term health.
Mm. Colleen, how would you integrate FES into therapy activities?
Yeah, it's great. It just seamlessly moves into what you're doing for therapy. If we're talking about what we're focusing today on the 300, it's great in the clinic to use as kind of a neural priming system, right? So you put your patient on the device, you can wake up their nervous system, get everything firing and moving, and then move into your traditional therapy activities. And then when we expand on the Excite, you can use both kind of hand in hand, do the RT300 and then move right towards the Excite for those task specific activities, making sure you're giving all that communication and input to the nervous system that you can.
Sure. And Lori, what misconceptions about FES do you encounter most?
There's a lot of them. I'm just going to touch on a couple of the biggest ones. And I think the one that I hear a lot and is the most heartbreaking for me is that some therapists think that people that have a complete spinal cord injury, so an ASIA A or ASIA B injury, won't benefit from FES or FES cycling because they aren't as likely to walk again. And I saw this in something in my textbook I used for my spinal cord injury class in PT school, which was only 2010, that basically was those motor complete patients. We're just going to do compensatory training with them. But really, we've heard today about all the health benefits we can get from keeping those muscles active. And I also think about it in terms of if we can keep your body healthy, then when that next therapy or that next technology comes along, like you're ready for it because you're healthy, your muscles are healthy, your bones are healthy.
Hmm.
That's probably the biggest one that I think we hear. People also think that if you have sensation, so you have an incomplete injury, that sensation is a contraindication for stimulation. But in fact, we can adjust all the parameters on every channel of stimulation so that we can get the muscle activity that's needed, but still keep the stimulation within someone's tolerance, right? So we can really individualize and customize that stimulation. And on
Hmm.
the flip side, people think lack of sensation is a contraindication because how do we know if it's quote unquote too much? But we have lots of other ways to determine if a patient isn't tolerating the stimulation or not. So really, we can work around sensation and lack of sensation in different ways. And I'll
Hmm.
share maybe two more. Um,
Sure.
People get nervous about using FES with patients that get autonomic dysreflexia, right? So when autonomic dysreflexia triggered by some kind of noxious stimulus, which could be electrical stimulation, but with the RT300, we have a lot of adjustments that we can make it less likely that the stimulation will trigger the AD for that patient. And also
Hmm.
know that over time, most people will accommodate to the stimulation and then AD is no longer an issue for them. So you have lots of ways to work around this as well.
Hmm.
And I want to add one more. So we talked about the frequency of use, and I think we've talked a lot today about 3 to 5 times per week, which, we recognize is not realistic for everyone. And I don't want people to think that if they can't get that frequency, that it's not worth doing. Because
Right.
even at just once or twice a week, you're still going to get benefit from that stimulation, and you can still get good progress in terms of those health benefits. It just might take a little bit longer than if
Hmm.
you are able to do it more frequently.
Yes. Which brings me to my final question. And once again, we will go around the horn, and I'll start with Colleen for your answer with this one. If you could leave the SCI community with one message about recovery, what would it be?
Well, your injury changed your body, but it didn't change the fact that your nervous system can adapt. So the connection might not be there from the brain to the spinal cord to the rest of your body, but your body still wants that movement. And we still need to teach your nervous system how to move so that you can get all of these benefits. And it's important to move for your long term health. So give your body what it is that it needs.
Move it or lose it, right? How about you, Lori? How would you answer that question?
Yeah, I mean, really very similar to Colleen. I mean, that physical activity is so very important. And just because you have this injury doesn't mean that we can't still find a way to activate those muscles to get those health benefits, improve quality of life, you know, even improve your caregiver's quality of life, right? If we can reduce, say, spasticity, it makes it easier for them to help you, then we're reducing their burden as well. Um, yeah, I like the use it or lose it kind of framing here, but doing these things again helps with your overall health and longevity.
Hmm. And how about Dr. Ian, as someone in one of those bodies like myself that needs to move it or lose it? How would you answer that question if you could?
Well, having been the third to answer, I 100% agree with both Colleen and Lori. They had the points, perfectly teed up. So I guess, reiterating, Colleen was saying that it's, better for our body. Lori was also mentioning that it's better for our caregivers, I would say it also reduces the burden on the health system because of
Mhm.
preventative uh, um, injury, illness, and disease. And my advice to the community would be whatever you can do, whether it's with an FES bike or any kind of home restorative exercises. Start now. It's already too late. Stop the excuses. Do what you can do. Stop when you feel you need to, and just keep pushing the benchmark. Some days you'll have it, some days you won't. But try to get moving. Do whatever you can do. A device like the RT300 pushes that, so far past what you can normally model in the home or at a center with a couple of weights and rubber bands. But not everybody's going to have access to this. If they have a device like the RT300, that's phenomenal. It gives you a major advantage on your longevity and your health outcomes. But whatever you can do, do it. And if you have a device and you haven't been using it in a while, like me, putting myself in front of the bus here, I need to jump back into it and get back active on it, because I know that I've already had some losses compared to where I was, just prior to the winter. So it's time to stop the excuses and get moving, because our body is not forgiving. If we don't keep it moving and keep it training, it takes a long time and a lot of hard work to get back to where we used to be. So the sooner we get into it and the more we do, the better it's going to be in the outcome in the long term.
Words to live by and wonderful advice. Again, Colleen Connaughton, Lori Magerfleisch, and Dr. Ian Brown, thank you so much for joining us today to tell us more about restorative therapies and the RT300 in particular. We look forward to having you back another time to talk about the Excite 2. But again, thank you so much for all of your insight today.
Thank you.
Thank you.
If you'd like to learn more about restorative therapies and integrated functional electrical stimulation therapy, visit www.restorative-therapies.com. There you can explore the RT300 therapy system and learn how it is used to help relax muscle spasms, prevent muscle atrophy, improve circulation, support muscle re-education, and increase range of motion. Individuals in the spinal cord injury community interested in the RT300 at home can click on our Home Therapy Hub to get started. This podcast series, provided by the North American Spinal Cord Injury Consortium, is about continuing that same mission of collaboration, education, and progress within the spinal cord injury community. By bringing together voices from research, care, advocacy, and innovation, we hope to highlight the people and organizations working to improve the quality of life for those living with SCI. Thank you for joining us for this second installment and for being a part of the community united in moving research, care, and recovery forward. If you would like to learn more information or have more resources, please visit nascic.org or contact us at info@NASCICONSORTIUM.org. That's info@NASCICconsortium.org. I'm John McAlevey, and I thank you for your time.